Hello, everyone. Today, I have a guest, Dr. Jensine Chavez, with me. She is the founder of Shine Through Strength Physical Therapy, a pelvic floor and orthopedic practice in Georgetown, Texas. And she helps women move with confidence through every stage of life, from pregnancy and postpartum to perimenopause and beyond. Oh, look, I've done those, 3 of those things. So thank you so much for being here with me today.
Absolutely. Thanks so much for having me.
Yeah. So I actually reached out to Dr. Chavez because I was like, I want to talk about intimacy after baby. And so many people have this as like it's kind of a heavy thing on them. And either it's that they just don't feel like it and they're touched out and they're like, is that normal? Is it common? Like, I hate how I feel right now. I don't want to feel like this. And I feel like I should be having sex, or like, oh, it's painful. And why is it painful? So I asked her to come on to talk about this. So why do you think that intimacy after baby is something that so many women struggle with and really a lot of people don't talk about?
Yeah, so it's actually one of the number one things that women come into my clinic for, behind leakage and low back pain. Like, those are the top 3 things: pain with sex, leakage, and low back pain. And I feel like low back pain and leakage is something that people feel like are more common. And, everyone's sneezing, like it's on all over Reels, all over TikTok and stuff like that. But when it comes to intimacy and when it comes to connecting with your partner, there's just this like pressure that once the doctor releases you at 6 weeks, everything's just supposed to go back to normal. And so I feel like a lot of women kind of suffer through this silently alone for many years before they're like, okay, I absolutely just can't do it. And sex is something they end up like enduring versus enjoying. And that's one of my passions, is just to help relieve that pain, get you to be able to connect with your partner and actually enjoy it and not just have to live through it. But the first step is just like seeking out help, right? And knowing that there's help out there for you that you can talk about this with. And it's not like something that you have to just keep to yourself.
Yeah, like it's not taboo. It's not embarrassing. And 6 weeks is such a joke. Like,
yes,
I'm 8 years postpartum and sometimes I still feel postpartum, It's just, nothing feels exactly the same afterward with any part of your body, really. And that's okay. Like, I always tell people, why would we expect our bodies to not be postpartum when they are? And we're thankful that our body was able to do everything to create our baby, but then we're like sitting here cursing our body because of the things that have changed from having that stinking baby. So I think that a lot of people don't anticipate this as much. They don't think about this prenatally as something that can happen. So can you explain why intimacy can feel so different after having baby, and like what are some of the reasons that people might feel like things are painful or all of that?
Yeah. So that's actually a loaded question, because there is like so many different aspects to our body, right? It's not just physical, but we also have the emotional component, the hormonal component. And so when we think about having a baby and carrying that baby for 9 months, right, in our pelvic floor, which a lot of people still don't even know what the pelvic floor is. So quickly, I'm going to kind of try to explain it so that the listeners can understand. But if you think of it, it's a hammock, right, and a sling of muscles that hold your bladder, uterus, and your rectum. And as baby grows over 9 months, what happens is that pelvic floor begins to have increased load and increased pressure, because naturally your baby's growing. And then you deliver that baby. And based on how that delivery goes, whether there's, a little bit of tearing, episiotomy, unplanned C-section, things like that, all of those things play a factor into the healing and what happens to your body on the physical side. Okay. So just from the physical side, if someone were to go skiing and the number one injury with that is tearing your ACL, and they had to go get ACL surgery, you would think that the surgeon is going to make them go to rehab before and after, right? But that doesn't happen whenever people get pregnant. It's starting to become like more of like known, but it's still not something that's where it should be,
It's not an automatic. It should be an automatic.
Yes.
Oh, your body went through this, especially for a C-section.
Right.
Like, your body went through this. There's no other thing that your body goes through that is this transformative that we don't have some sort of aftercare for. And It's like, are we for real not going to allow, like, a lot of women don't even realize the 5-5-5 rule. I just taught a birth doula training. By the way, 5-5-5 is like the bare minimum. But I just taught a birth doula training, and there was a labor and delivery nurse in there who is transitioning into being a birth doula. And I was like, I don't think I'm going to be able to teach her anything, right? Like she knows everything. I'm just going to be teaching her like the more loving side of things because she already knows all the anatomy and all of the education. And I started talking. I was like, how many people here have heard of the 5-5-5 rule? Because we had 8 women in there and only 2 of them raised their hand. And one of them was not the L&D nurse. And she's like, I've never heard of this. I was like, what? Like 5 days in the bed, 5 days on the bed, 5 days near the bed? And she's like, no. And I said, oh my gosh, like this is the problem. Why are we not teaching this in school to the people that are caring for women while they're going through this? That afterward, our pelvic floor, I always tell people like your baby was kind of like the block for your like, blocking all of that pressure. There was still pressure, but like the baby was wider than your bones. So at least it was all being kept up there. And then after the baby is born, that block isn't there anymore to kind of protect your pelvic floor, although it had pressure on it, but not, I feel like there's more once the baby moves out of the way. And now we have all of the organs are like, let's try to settle back in there. And they're like, oh man, it's wider than it was. And everything's heavier than it was. And trying to find its place again. Right. And our bodies need rest and recovery. They need us to not be getting up and doing the laundry and changing out the dishwasher and vacuuming or taking a walk even around the block. And so many women aren't even taught that they need to protect their body in this time, not just by not doing, but also by getting physical therapy.
Right. Right. Yeah, it's insane. And it's like, you know, you go through these things and it's like each time you learn a little bit more. Like, I know you're just got off the phone with a family that you're helping with their 4th delivery and pregnancy, right? But I'm sure each time they learn something new. And it's like, man, if they could just get more knowledge on the front end of things, then they don't have to suffer through so much pain like some of these ladies coming to me now. Like you said, I think you said you're 8 years?
I've been doing... I'm 8 years postpartum. Yes.
Right. So I have ladies that are coming to me and now their kids are in college and they finally feel like they can take care of themselves, you know? And it just breaks my heart because it's like, mama, take care of yourself, you know, but it's not that they don't want to. It's just that they don't know that this is out there.
Or that, I mean, you don't know how many women that I talk to that are saying things like, oh my gosh, I peed my pants when I was jumping on the trampoline with my kid the other day. And I'm like, hi, common but not normal. Like there's help out there for you. And I tell them about that and they're like, I didn't even know pelvic floor PT was a thing. And so can you explain the why behind, I mean, obviously if somebody has a tear or an episiotomy, that would be something that could cause pain later. But can you explain the why behind like pain with intimacy afterward and kind of the mechanics of that? Not everybody has it, but some people do.
Right. And so when we think about pain with intimacy afterward, like we've been talking about now, it should definitely be something that we prepare for before postpartum happens, right? And some of the conversations that should be happening between partners, birth team, whether it's with the doula, prenatal postpartum counselor or PT, things like that. So that there's already this expectation that, hey, it might not feel the same. So there's not as much pressure on mama. Okay. So that's just one side of things. The other side of things, like we talked about, is the physical, right? And so when we talk about tissue healing, when we talk about, extra heaviness and just things feeling different, those are all factors that will contribute to pain with intercourse. And so when mamas are like, okay, my OB cleared me, I'm going to go back to doing this really intense workout regimen because I'm just trying to get my body back, right? And they don't take the time to reconnect with their breath, reconnect with their core first before jumping into those things, then the muscle tissues or that sling that already had that increased pressure or trauma that happened to it is now getting tighter and tighter or weaker and weaker if you don't know what you're doing with it, right? And so those are some of the physical reasons that sex may feel more painful postpartum. Is just we have not reconnected with the body. And until we do that, going back to like the ACL tear until we can figure out, okay, this is how I bend my knee. This is how I straighten my knee. It's the same thing with your pelvic floor. That's going to cause some pain and discomfort there.
Yeah. And the reason that I even learned about you, right? I think you were posting about a workshop that you were doing. Can you tell us a little bit about, like, I think it was about connecting and intimacy and relationship after baby. You know, obviously don't give us the workshop because people need to come to your workshop if they want to do that. But can you give kind of a brief overview of the kind of things that you help people with?
Yeah, absolutely. So in my workshops, it's so much fun because we get people that are coming from all different stages of postpartum. Like I said, some people, their kids are in college. Some people, they're barely, 10 weeks postpartum. And so it doesn't matter really how far along you are on the postpartum spectrum until you've had pelvic floor PT and until you've had someone look at your breath, look at the way your core is contracting, and then look at how you're applying that to functional activities like squatting, walking, jumping. You're still going to have issues, whether that's pain with sex, whether that's leakage, or the opposite of it, constipation and incomplete emptying of your bladder, right? Yeah. And so those are the things we look at. We look at the very foundational layer, and then we start to build on it to see what's going on throughout your day. So for example, if I've got someone that can breathe correctly and contract their core correctly without coning and doming, then we turn it into
coning and doning. Tell us what that is. I'm like, yes. You finally said something that I'm like, okay, well, I'm going to need a little schooling too.
Okay, so coning and doming. So
doming. If you're laying, maybe I do know what it means, but still.
Right. So if you're laying on your back and you're trying to do like a bicycle or a crunch, and you have that, I'm going to turn my camera down so you can see.
Go on YouTube if you want to watch her.
That little part in your stomach that kind of just like pops up, and it's like a big literal cone and dome right here. That is showing that we have a pressure mismanagement system. So what moms think is like, oh my God, I do CrossFit or I do HIIT workouts, I do Pilates, and I'm strong. I know I am. It's not that you're not strong. It's that your deep core on the very like foundational level is not contracting the way that it needs to. So that coning and doming occurs when your superficial core muscles start to take over. And this is what can lead to diastasis recti, low back pain, leakage, and also pain with sex, because muscles that should be not working as hard are to compensate for that deep core.
Yeah. And I mean, there are people, by the way, do couples come to that, or is it just the person who gave birth?
So at the moment, we've been focusing more on like women's wellness, but we are transitioning into like, hey, men need this too. And what's been happening
and also to understand what's going on with the woman.
Right.
If we could just get a little education for the younger generation about what happens to a woman's body when she has a baby.
Yeah.
I mean, I have an 8-year-old, and I will be darned if he is going to be a partner who doesn't understand what his, partner's body is going through when she has a baby. And I'll be darned if my daughter doesn't share with her partner about what's going on with her body, because this is not something to be ashamed of. This is something to bring attention to, because how do we expect our partners to support us if they don't even understand hardly any of us understand the basics of what is going on with our body, let alone the other gender.
Yes. Yeah, that's huge. That's huge. With prenatal PT, before they go into the labor and delivery aspect of things, we definitely have husbands in here learning how to help with the perineal stretching, learning how to help with labor positions and where to apply pressure to better support mama. And then, sometimes they do come into the clinic for postpartum relief too, because there's things that husbands can help with at home. But that's a good idea to bring husbands into this so that they can see what their wives are going to. Yes.
I'm like, I also think that they should go to the birth class, go to the breastfeeding class. Because how are you going to support your partner if you don't even understand what it is that their body's going through?
Right. And one of the things now is that, with daycare expenses being so high, there's a lot more movement of moms staying at home and husbands working, which, this was always a thing. But I feel like now this is what I'm seeing more just because of inflation. And so a lot of things that I hear is like, okay, my husband's coming home and he's tired from work. But what he doesn't realize is I've literally worked without any breaks, without any relief, without any help. And now I just kind of have to cater to him. And that's not always the case, right? Some husbands are aware, but I feel like this is something that I've been noticing a lot lately too.
It's a systemic issue. Yeah.
Yeah.
The good ones totally pitch in and do their part. And everyone should be the concept of pitching in. It's all of us doing it. It's not just one person and then you're helping. You're not helping.
Yeah.
We are all helping.
Yes.
But I really find that because a lot of men don't understand what's going on with the body, they might have shown up and helped more if they had known. And I think that if we integrated them into the process ahead of time, there would be less shame and embarrassment about what's going on with the body, because I think that a lot of pain also comes from unsureness, nervousness, embarrassment of like my body changes, things have stretched and moved differently. And things mostly go back, but it might not look exactly the same and all of that. And I think if a lot of this is emotional, and emotion is stored in the body as well. And our nerves are firing in different ways, and our chemical reactions and hormones and all of that are playing in. And I think that if we had more education on the front end that partners knew about, there might be less shame and embarrassment, although there should be none, but there is for the woman who's experiencing it, to be able to share and not feel like, ugh, he's going to think that I'm broken, or like, we shouldn't. I know that we're like, there are women that don't feel like that. And like, how could anybody ever feel like that? Well, they do.
Mm-hmm. Yeah. And it's more common, I feel like, than not to feel those feelings of feeling broken. And, you see all these like shows and movies of just women are just super mamas, like they're doing everything, right? But it truly, truly does take a whole village. Like a lot of women can feel alone in their journey of motherhood. And so having these conversations, again, prenatal, possibly even before conceiving, will help then on the back end of things when your body is really going through it, because your partner will hear you. It's hard because I gave the example of the ACL, but I'm going to switch it now to like a rotator cuff tear, right? That's something that you can visibly see that, okay, she can't reach as high. She's not as strong. She's actually in pain. You can see it. Mm-hmm. But then when we have perineal tearing or labial tearing, obviously those are things that you can't see. And so when women go through burning with wiping, or it feels like Indian rug burn with insertion, or it feels like he's hitting my cervix. All those things, those are things that they cannot see or feel. And a lot of times women will just kind of pretend because they feel like this is like one of their duties to do. And so, just if there was more education, more knowledge about this out there, I feel like, the return to intimacy would be a little bit easier for people, for sure.
Yeah. What are some like practical ways? What does that look like when women begin reconnecting with their bodies postpartum? So like when you say feeling kind of connected to your body, what does that look like?
Yeah, that's a really good question. And that's a really hard thing to uncover.
I know. I ask you like these loaded questions. Give us what you think.
Yes. Yeah. But truly, that is a really good question, because one of the other things that ladies talk about are like, okay, I don't have as much pain, but it's so hard to climax or orgasm now, or I just don't have the same sensations as I used to before. And that just all goes back to, okay, maybe your pregnancy was your dream pregnancy and it went completely as planned, right? But that doesn't negate the fact that your muscles still went through it for 9 months and however long it took you to get that baby earthside, right? Mm-hmm. And so naturally your abs start to stretch. Naturally, we start to breathe differently and things like that. And so one of the biggest practical tips that I can give moms to know if they're connecting to their pelvic floor is not Kegels, okay?
Not Kegels. Kegels are magic, and they are not.
They're not.
Relax as much as you can contract.
Yes, and they can absolutely make the pain worse, okay? And leakage worse and all the things because you think tighter, tighter, tighter is good. But then if you're like, constantly doing a bicep curl and your elbows constantly flexed, your bicep's going to spasm and so will your pelvic floor. Okay. Little tangent.
I love these examples you're giving. They really give a visual. I love it.
Thank you. I feel like it's just so hard to visualize what goes on in the pelvis, And
yeah, people don't picture it. They don't visualize it. It's not something that we're like going upside down and looking with a mirror all the time, right? So these other body parts that you're using make so much sense.
Thank you. And okay, the question, what's the question again? Sorry, girl.
No, it's good. So like what does that look like? You said the biggest thing that I know I interrupt people all the time, so you're fine. That's my fault. So what does that look like? And you're saying some advice that you would give people is not Kegels.
Right. Okay. There we go. We're back. So I would say, if you're listening to this right now, you can actually do it. So put one hand on your chest and one hand on your stomach. And I want you to feel which hand moves more. Okay. So is it your top hand when you inhale? Is it your bottom hand? Or is it both? Okay. And what we're looking for is that it's the bottom hand that's moving more, because then you're truly connecting to your diaphragm, which is then connecting to your core and then your pelvic floor. So naturally, when we inhale and inflate our tummy, our pelvic floor has to drop. Okay. So this is, again, if you want visuals, come on YouTube. But if this is your stomach hand and this is your pelvic floor, when your stomach inflates, your pelvic floor has to drop. But if it's not inflating and it's constantly sucked in, that's another thing women do is sometimes they suck in or yes. And they clench during, yes, exactly. But that causes tightness and does not have pleasure, right? So I guess long story short is put one hand on your chest, one hand on your stomach. And that's the easiest way to know if you have a pressure mismanagement. Or if you've just been, using your neck and shoulder muscles as secondary breather muscles just to get that oxygen. So for a mom, early postpartum, what you can do, or even like when your kids are young and they haven't experienced stress, you can look at how they're breathing. And like 90% of the time, they're breathing with their tummy, like their belly is really expanding because they haven't really experienced that stress or pressure that we do as adults. And they haven't learned how to use their secondary muscles just to get quick oxygen. And so it's harder to breathe diaphragmatically, but that's how you really connect to your pelvic floor.
Oh, that's so interesting because I teach hypnobirthing classes. And so when I talk about the wave breath, or it's a contraction, like what do you do during a contraction? When I teach people to practice, I tell them to interlace their hands like this and to put them over their stomach, and that they don't have to do that forever, but that the first couple of weeks that they're practicing to do that, because I say, I want you to fill the space in your hands so that you're not coming into your chest. I want you to focus on when you inhale, your hands should expand, because so many of us actually have the opposite. It's like, we suck in when we inhale and then we let it out when we exhale. And that's the opposite of what we should be doing. And so I love that you're giving that, because that's exactly what we're doing. So they just need to keep doing their wave breath after. I always say hypnobirthing is for life, not just for birth. Because you can use all of these tools later on as well. But I mean, I tell people too, when you're giving birth and you need to release your pelvic floor to allow and make space for your baby, I say you wouldn't have sex with your jaw clenched and your pelvic floor clenched, because maybe some people do. And it's kind of a reaction that they have. But actually, if you're having sex and you allow your pelvic floor to release, it's actually more pleasurable generally. And so, but most people won't let that, it's almost a defense mechanism, or even if we are happy to be having sex and we love our partner.
Yeah.
It's like a self-conscious reaction, I think, subconsciously in a lot of women, that we try to be tight down there. And it's not as pleasurable when you're sitting there and contracting your pelvic floor. And I also think that a lot of times women, because of the postpartum hormones and things like that, in general, things are less pleasurable because our dopamine and all of these things are kind of out of whack a lot of times. And there are people who get on anxiety medications, and some of the anxiety medications will make it so that you don't have a sex drive. But there are some that don't have that impact. And people actually notice that they have more of a desire to have sex now because they're not depressed and because they're not experiencing that. So again, you're right. It's so nuanced and there's so many things that go into it. So we should be getting that mental health help if we need it and to go through that. And we should be, having that one-on-one time with our partner and sharing what's going on with our body and establishing that ahead of time, because a lot of people don't talk about these things before they have kids. I have couples who have been together for 7 years before they even tried to conceive, and then they have a baby. And then the girl's like, this is not glamorous. Like, I did not know I was going to be sharing all of, like, my husband was pulling up diapers on me while I stood up and blood was running down my legs after I had a baby. But I wasn't embarrassed because I knew that he was so down. Like, he just did not care. But with my ex-husband, I would have been like, get out of this room, Yeah. And the relationship part is so important, and not feeling like you have to, make your body a certain way will actually make things more pleasurable for you.
Yeah. Yeah. And that's spot on what you said about like women clenching during sex. A lot of times I hear, okay, well, he told me to squeeze harder. And, they said that it feels better when I squeeze. And that is like a really, really, really big myth. Okay. So pleasure comes from relaxation, not from more work. Okay. So remember that a lot of people will have a lot of pain with insertion, a lot of pain with thrusting, and they anticipate the pain. So they're like, and like everything clenches up, their core, their pelvic floor. So I think the biggest piece of advice I would say is, number one, do not clench during sex, right? Your pelvic floor muscles, yes, they are your orgasm muscles. They also help with leakage, constipation, things like that, but they need to be trained outside of what's going on. So training for your pelvic floor does not occur in the bedroom, right? So you shouldn't be like physically contracting and relaxing during that time. And, just making sure that you take a deep breath in during insertion, making sure that you're open with your partner of what hurts and what doesn't hurt, so that it can kind of be fun for both of y'all, trying to find a position that pleases both of you guys, right? And it's reciprocal.
Yeah. So at what point, should someone seek help if they are experiencing pain? I mean, obviously there's going to be pain until an incision is healed or something like that. And stitches have dissolved. We shouldn't really be using that area anyway at that point. But I think it's probably a trick question, because I have a feeling the answer is right away, like before there is pain, before you even know if there was going to be pain, so that we can preemptive strike. Is that what the answer is?
You're going to love this. So yeah, definitely before postpartum. So typically the way that it goes for prenatal to postpartum, here's like the whole continuum. Prenatally, we start at 16 weeks and we go every other week until 34 weeks so that we can get ahead of the symptoms that happen. Normally at 16 weeks, moms are typically still feeling really good. They're just now starting to get that round ligament pain, maybe some aches in their hips and their low back. And they're like, I can push through. And then we get to, 28 weeks, 30 weeks, and they're like, oh my God, I can't bear it anymore. Right. And so the strengthening and the coordination needs to start early. 34 weeks and beyond, we start to lengthen even sooner. Actually, if they're already experiencing a lot of pain and tightness, we start the lengthening process sooner so baby can get out easier of the canal.
And that's true. Like, this isn't just for intimacy afterward. It's the difference I see in the pelvic floor health and the ability to push easily.
Yes.
And that pushing phase being shorter is how much work people have done ahead of time to relax.
Yes. I've had moms go from a grade 4 tear to a grade 2 tear. Literally, I've had first time moms come in and they're like, I literally only had to push 4 times and the baby was just out. Because again, the misconception is like, okay, I got to wait for my contractions to get closer. Let me just lay in this bed because no one's coaching me on what to do, right? But in reality, we should be helping baby move down the canal. And then that will transfer postpartum because you have less trauma, less tearing, less unwanted or unneeded medical interventions, right? But then, so your question, postpartum, when should they come? We start as early as 3 to 4 weeks postpartum, even before OB clears you. Not that we're doing any internal work or anything directly impacting the pelvic floor, but like what we talked about is just reconnecting with your breath and reconnecting with your core. Old school way is like, okay, let me just rest. When you, again, going back to injuries that you can see, like I hurt my wrist. Let me just immobilize it, rest it, and ice it. And then in a few weeks, let me start. But then what happens is everything gets stiffer. So once you get out of that brace or whatever you're using, you don't have as much movement as if you would have started sooner. So it's the same thing with your pelvic floor. We're not working really so much to strengthen it as we are to reconnect that connection.
Yeah, that makes sense.
Mm-hmm.
Man, I feel bad sometimes doing these episodes because I feel like a lot of people are like, well, I didn't know that and I wish I had known that, but we can only do what we know. It's fine. I always say, you don't know what you don't know. And so we can only move forward. It's never too late to get help. Yes, it would have been more helpful if you did it earlier, but a lot of us didn't know. And the system is not set up for us to get that help that we need. A lot of insurances don't help with this. And financially, it can be quite a burden for people. So I would love for you to tell people how they can find you. And so if they want to work with you or they want to learn more from you, and I'll also put that in the show notes.
Yeah, absolutely. Well, first off, thanks so much for having me on here. It's been fun just getting down to the things that, some people are really nervous to talk about. And so hopefully this just like lifts a burden off of some mama's shoulders and they can see that they're not the only ones going through it. So we have definitely some online stuff that you can find us on. We're on Instagram, Facebook. Instagram is @ShineThroughPT. And then we also offer free 15-minute discovery calls if they're just like, hey, I think I resonated with this piece or this piece. Like, how can you help me? Like our team would be more than happy to talk with you. But yeah, if you're listening and you're like, wow, I really resonated with this, don't hesitate. Please reach out and we'd love to help you.
Thank you so much.
Yes, absolutely. Thank you.
Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.